Hello, this is Dr. Avinash Borade, ENT surgeon from Navi Mumbai. Today we are going to cover a topic called snoring and its causes and the treatment. So snoring is very common symptom which people are experiencing in day-to-day life. Many people are having loud snoring, and for which they are coming to ENTs and other family physicians for the to know the cause and taking a treatment. So many times when patient comes to us, we try to ask few questions. So there are important questions which we need to understand or ask. So how loud is the snoring? If snoring is very loud, it's like snoring can be heard in the other room. Snoring is disturbing people who are sleeping in the same room or even in the other room. Then there are some social problems which happen. If you are going to any relative's house or you are traveling in a train or bus, then your snoring is obviously disturbing a lot of people, and that can create a lot of embarrassment. The other important cause for which you should take a treatment is obstructive sleep apnea, which is a medical condition which patient is suffering, but patient many times or person many times do not know that he is having a obstructive sleep apnea. That means oxygen saturation while sleeping is going very low, and that is disturbing and giving lot of stress on the heart, lungs and even the brain. Your sleep patterns are getting disturbed, REM and non-REM sleep patterns are not completed, and because of that brain doesn't get proper rest. So when you wake up in the morning, you do not feel fresh. So that is the second question we ask. Third is, many people have daytime sleepiness. So after having lunch, if they are sitting idle, they feel very sleepy. Many people have very reduced sleep latency, that means they can very easily sleep. If they are sitting idle for 2 minutes, they fall asleep. So these are the indications that you may have obstructive sleep apnea. So it is not only the social cause, but it is a medical condition which can in long term give rise to a lot of heart problems, lung problems and a lot of reduced work efficiency, because your sleep is not happening properly, you are not feeling fresh during the day, so it affects your work. So for snoring, there are some home remedies you can or some things you can do it at home. So try to reduce all the habits. Alcohol consumption, smoking will create lot of congestion. It will help to deposit the fat in the neck and oropharynx areas. So you should avoid smoking, alcohol. Should maintain the proper body mass index. Body mass index is a ratio of basically body weight and height. So if you reduce the weight, it is obviously going to help for snoring for a lot of people. So always try and focus on your eating habits and even sleeping habits. Sleep hygiene is also very important. You should have a fixed time of sleeping preferably, and 6 to 8 hours of sleep is very much necessary. Try to avoid use of screen 1 hour before sleep time. It will help you to get a sound sleep. So what we do when patient comes with all these symptoms, we try to find out the causes in the structure. So there are some structural problems because of which snoring can happen, like grossly deviated nasal septum, sinusitis or infections, increase in size of the turbinates. The other part which we want to see is the oral cavity. We call it oropharynx, in which we see tonsils if they are enlarged, if palate is very flabby and the tongue base is very large. So mainly this is the area where snoring or obstruction in the air passage happens, and there is a loud snoring which is happening. Then if patient is having a history of loud snoring and it is suggestive of obstructive apnea, we advise them to undergo sleep study. Sleep study is the test by which you will get all the parameters, what is happening during the sleep, how much you are sleeping for how many minutes, positions, oxygen saturation, how much respiratory distress is happening, what is if there is a lot of strain which is happening on the brain or heart. So depends on the report of polysomnography or a sleep study, we grade patients into mild, moderate or severe problem. So accordingly to this, we then offer patient treatments. In treatment part, there are surgical and non-surgical, both options are available. Non-surgical options are treating the infections in the nose. We give nasal sprays, try to open up the nasal passage, and we give CPAP machine for users. CPAP is a machine which gives pressure and overcomes the obstruction in the breathing at night when you are sleeping. So CPAP can be used till the time when your body mass index goes low, obstruction goes low. So more or less CPAP machine has to be used for a long term. Other option, that is surgical option, depends on body mass index mainly. If patient is not very obese, which is a major cause of obstructive sleep apnea and snoring, surgical options are very useful. We can try to identify specific blockages in the nose or in the oropharynx and laryngopharynx and surgically correct the blockage in the air passage. We can open up the nose by doing surgeries for deviated nasal septum or turbinates. We can do surgery for enlarged tonsils or flabby palate or a large tongue base also. So by doing surgeries, there is opening of the passages, so airflow will be regular, so there will be no snoring because there is no obstruction to the airflow. So here at Dr. Borade ENT clinic, we are evaluating snoring in detail with the help of history, examination and other tests like sleep study, sleep endoscopy. We can give you the best possible diagnosis and treatment options to you. So any person who is having loud snoring in your family or persons are suffering symptoms of obstructive sleep apnea, please you can visit Dr. Borade ENT clinic. Thank you.